Hi, I'm Lisa Gill, Senior Analyst and Managing Director with jpmorgan. With me today is Chris Schott, our Pharmaceutical Analyst and Managing Director. Chris, how you doing?
Good, good.
We're coming to you live from the JPMorgan Healthcare Conference in San Francisco. Roughly 9,000 people have attended our conference this week, along with 485 companies. It's always a great conference, and a few of the highlights for me would be the panel that you and I discussed. Chris and I hosted a panel yesterday afternoon with senior leaders from the pharmaceutical industry as well as the healthcare services industry. As we think about the conference, Chris, what would you say are some of the biggest takeaways from your perspective?
Sure. So from my perspective, within the pharma industry, I think it's been this tug of war, kind of seesaw between the pricing controversies I think everyone's aware of, and innovation. And I'd say the big takeaway for me in this conference was innovation. So first of all, we're looking at FDA approvals. So we're seeing record levels of new drugs being approved. And we had a chance to interview Scott Gottlieb, Commissioner of FDA, and Dr. Gottlieb's talking about further initiatives to further streamline the approval process for new drugs. And then we talked about to the companies. We heard from CEOs across the pharmaceutical and biotech industry, and their pipelines honestly have never been better. So that dynamic leaves us still very optimistic on the outlook for the sector going forward. Now, Lisa, I know for you, consumerism in healthcare is a big theme, and you've written a lot about it. What were the takeaways on your end?
We have. Consumerism in healthcare, and we really think about that as the disruptor of healthcare.
Sure.
And as you think about the individual, you and I, paying a lot more out of pocket today for pharmaceuticals, for healthcare in general, and we really need better solutions around quality, cost, and convenience. And we really think that there's a number of opportunities in the marketplace today where you get those services, the combination of companies that have come together, things like virtual health. And we start to think about transparency around pricing. We start to think about what this really means to the consumer, and we think the drive is really going to come from the consumer themselves because they're paying more out of their own pocket.
That makes a lot of sense. Thanks for those comments, Lisa, and thanks everyone for joining us today.